Hi guys, happy Friday. I'm Dr. Lucky Sekhon, the host of Fertility Fridays, and today we're going to be talking about the reproductive checkup. So we get a lot of questions about the reproductive checkup. What does it entail? Who should get one? When is it time to see a fertility doctor? And I think these are all really important questions. I think we've gone from having really well-defined criteria of who should go and when they should go to making things a lot more inclusive and broad, which is a good thing. The traditional definition of infertility was for heterosexual couples who'd been trying on their own for at least 1 year without success. But now we know that there are many different scenarios where you could use the help of a reproductive endocrinologist and infertility specialist. So first off, if you have a heterosexual couple who's trying, they don't have to wait a whole year to get a reproductive checkup. It's not wrong to get a reproductive checkup even after 2 or 3 months, especially if you have specific concerns or questions. There is really no downside to seeing a doctor early. It's all about getting information and potentially avoiding wasting time. Like I said, it's not just about that one scenario of a heterosexual couple. We also have same-sex couples or individuals who are interested in becoming single parents by choice, whether that means using a sperm donor or an egg donor. There are individuals who are single and not in a place where they want to start building their family in the near future, but they know that it might be a priority one day. And they may want to discuss things like fertility preservation, whether it's egg or embryo freezing. So there's really no end to the types of scenarios where it makes sense to have a visit with a fertility doctor and learn more about your options. Additionally, in couples or individuals who have known risk factors, whether it be in their own medical history or in their family history, that might be enough to prompt visiting a reproductive endocrinologist to get a fertility checkup. Examples of this include someone who knows that they have really terrible fibroids that cause heavy periods, irregular bleeding. They're going to be concerned that one day when they are ready to start trying to conceive, will their fibroids be an issue? Similarly, someone who's had several ovarian cysts removed might be worried about their egg count. Or an individual who has a strong family history of women undergoing premature menopause may be concerned about their egg quantity and what it looks like, even though they're not in a place where they're ready to start building their family. So these are all really good reasons to get the conversation going with a fertility doctor. Now, another major question we get asked is, well, what does having a fertility checkup entail? And I think it's important to really define this and to also gain an understanding of the things you can and cannot test for. So it's easiest if you break it down by thinking about the sequence of events of what it takes to get pregnant. So let's start with the sperm, right? Because that's the first step. The sperm gets deposited in the lower reproductive tract and travels up the length of the reproductive tract through the uterus and through the fallopian tubes to hopefully meet an ovulated egg. So for the sperm, that's one of the easiest tests that we can do. It's called a semen analysis, and it involves getting a sample, an ejaculated sample that we look at under the microscope, and we look at a couple of different metrics, 4 to be exact. The concentration of the sperm, the percent of the sample that's swimming in a forward direction, the percent of the sample that's shaped normally. We look at things like the head to tail ratio, and also the overall volume of the sample, because that will indicate if there's any blockages in the male reproductive tract. And if something comes back abnormal, we usually will retest, because men are always making new sperm every 72 days, and there's a chance that the sample might have just been a bad sample. So it's always good to verify. If it's found to be abnormal on 2 different occasions, we usually will have them follow up with our male reproductive specialist. Our urologist in our clinic, his name is Dr. Barhama, and he regularly sees our male patients for consultation, doing a thorough physical exam, a series of hormonal tests, and even an ultrasound to try to identify if there's any underlying medical issues. The next step of the process to getting pregnant involves the sperm traveling through the reproductive tract. So you want to make sure the reproductive tract is patent and free of scar tissue or other structural problems. There's actually a 2-for-1 test that can be done called an HSG or a Hysterosalpingogram. This is basically an x-ray of the pelvis. Most of the time this is done by a radiologist, but many infertility doctors will do this testing as well on their own. And we place a speculum and we put dye through the cervical opening and watch it spill into the uterus and out of the fallopian tubes. And the way we visualize it is by doing this x-ray of the pelvis. And it will identify not just if there is a blockage in the fallopian tubes, but also if there's any sort of blockage, scar tissue, or any structural issue with the uterine cavity itself, because we really should have a nice smooth contour, but sometimes you can have a fibroid or a polyp, for instance, that could be taking away from the surface area that an embryo has to implant. There are other ways to look at the uterus too. We could just do a regular ultrasound, a vaginal ultrasound, to get a nice clear view of the uterus with 3D imaging. And while we're there, we're going to look at the fourth component, which are the ovaries. Now with the ovaries, we care about really 3 major things. Is a patient ovulating regularly? The best sign of that is that they have a regular period. And we can do a series of hormonal tests to confirm that they're ovulating regularly and that they don't have underlying problems that can lead to irregular ovulation, like polycystic ovaries, for example. We can also do blood work and ultrasound to look at egg quantity, or how many eggs there are at that snapshot in time. Women are born with all the eggs that we're ever going to have, and we can't make new eggs and we can't modify our eggs, so both the quantity and the quality start to diminish over time. So we can actually evaluate where you're at quantity-wise right now by doing 2 things. A blood test called AMH, or Anti-Mullerian hormone. This can be measured whether you're on the pill or off the pill, wherever you're at in your cycle. And the higher the level, the more eggs you have, right? Usually we say a threshold of 1 or 1.2 NGs, or nanograms per milliliter, is considered a normal count. But again, this needs to be interpreted by an expert, because what's normal for a 20-year-old isn't necessarily normal for a 40-year-old, and vice versa. The other thing we can do to look at your quantity is taking pictures of the ovaries on ultrasound and visualizing how many eggs we can actually see at the surface of the ovary. Every month, a certain number get recruited to the surface, and it's like a rationing process. The number that get recruited is always going to reflect how many there are overall. And that's a really accurate and important way to look at someone's ovarian reserve or egg quantity. Lastly, egg quality, which is the most important factor to one's natural fertility, is actually not something that we can test for. All we can go off is your age. And we know that as we get older, more and more of our eggs start to become genetically abnormal, yielding genetically abnormal embryos. And we get a lot of this data and information from all the IVF cycles we do, where we genetically test the embryos. So unfortunately, we don't have an individualized way of assessing your egg quality, but we can look at your age and deduce, based on your age, what we think your egg quality is doing now and where we think it's headed in the future. So that's the one area where we really do lack individualized testing. And that brings me to my next point. I think it's important to not oversell the reproductive checkup. While it's really important and it's going to rule out a lot of potential barriers to being able to get pregnant, it's not the end-all be-it-all. You're not going to be able to identify or really understand an individual's egg quality beyond just looking at their age. And it's not necessarily going to identify if there is a barrier, because you can't test for every possible barrier to getting pregnant that exists. Additionally, it may not point you in a definitive direction treatment-wise. That's where talking to a reproductive endocrinologist really is important, because it's all about formulating a strategy that makes sense based on what your goals and objectives are, and also based on your individual test results. So for that reason, I think it makes complete sense to seek consultation early if you have any questions, because let's face it, a lot of the education that most of us received growing up about our bodies and how our reproductive systems functioned really focused on how to avoid pregnancy, not how to get pregnant. So, as a fertility doctor, I see a lot of patients who don't really understand how their bodies work. So I think even just making an appointment, not to seek care, treatment, or to take any action, but just to get educated about how your body works. I think it's a really good idea for anyone who thinks that they may be interested in building a family one day, or who is just curious about how it all works. So I hope you found this really interesting and informative. I want to remind you that this does not constitute individual medical advice. If you have any specific concerns or questions, the best thing you can do is just make an appointment for a fertility checkup. And we would be happy to see you. So please don't hesitate to reach out if that's what you'd like to do. And we hope that you found this useful, and that you'll tune in next week for our next installment of Fertility Fridays. Thank you. Hey guys, thanks so much for checking out this video. We hope you enjoyed it. If you liked the video, please give us a like, or better yet, hit that subscribe button. We want you to always be in the know about our newest episodes. Also, please don't hesitate to leave us any questions or comments in the section below this video, and we'll do our best to get back to you as soon as we can. See you later, guys. Hope to see you next Friday.